viewers, and welcome to this special edition of Sight Ed. It's a special edition because today we will be talking about the commonest cause of blindness all over the world. And that cause of blindness is cataract. And it's also a special edition because we will be starting another movie, also an eye health movie titled You Are My Eye. And coincidentally, You Are My Eye is also premised on the disease cataract. So you're once again welcome to Sight Ed, the sight educational program designed to enlighten me and you so that we can enjoy good vision. Today we have also interviewed a specialist, a consultant ophthalmologist on the disease cataract. So he will be talking to us about what is cataract, what are the causes of cataract, and along the line as he talks to us, we will be able to understand some myths, some misconceptions about this disease called cataract and its treatment. So today we will be listening to Dr. Aribaba Temitayo Oluwafisayo. He will be discussing the disease cataract.
I'm Dr. Oluwafisayo Temitayo Aribaba. I'm a consultant ophthalmologist with the Lagos University Teaching Hospital and a senior lecturer with the College of Medicine, University of Lagos. My task today is to discuss cataract, which is the commonest cause of blindness all over the world, more so in Nigeria, where it accounts for almost 50% of the causes of blindness in this country, following the National Blindness Survey. Cataract is the opacification of the human crystalline lens. Every human being has a lens that is transparent. But when that lens becomes opaque, then we have cataract. The opacity can occur at birth, that is in utero, when the baby is inside the mother, or it can occur as the child is growing. We call it developmental cataract, but mostly we see cataract in the elderly, which we call age-related cataract. When patients develop cataract, the ideal thing is for them to come to the hospital where they can see doctors and they can have necessary surgery, and sometimes glasses may help, but mainly surgery, so that when they come, they have the appropriate surgery and they gain back their vision in no time. Cataract surgery is the most cost-effective intervention known to mankind surgically. It is comparable to oral polio vaccine, to other immunization. Is comparable to vitamin A distribution and supplementation. There's no surgical intervention known to mankind that can be compared to cataract surgery. But the major problem we have has to do with barriers to uptake of cataract services. Sometimes government sponsors surgeries, but patients may not turn up because of fear, sometimes because of distance, sometimes because of the cost. But even when it is free, sometimes patients will not turn out because they are afraid of the outcome. When we were much younger, I remember our elders would prevent us from playing the Ayo game, especially towards evening, believing that when you play Ayo game late into the night, that as children, when we grow up, we will develop cataract. And then they will advise us that we should pick the seeds and use it to touch our lids before playing the game. And that's the ritual all of us follow so that we won't develop cataract, because it's believed that it is the seeds that shows up inside the pupil, and that's what is responsible for the whitish reflection that people see when adults develop cataract. Cataract, number one and most important cause of cataract is aging. As we go older, as we develop gray hair, people tend to develop cataract. And it's like what you see when you pour garri inside water and then it swells up, or you drop a slice of bread inside water and it swells up, the same things happen to the protein inside the lens. As with time goes on, it swells, and as it swells, it becomes whitish, and that is how cataract develops due to aging. The other cause of cataract is some patients with diabetes mellitus, for example. Patients with diabetes mellitus that is not well controlled may develop cataract even before the age of 40, especially if they have poor control diabetes. The other important cause of cataract, it will include trauma. It's not impossible for people to sustain injury, and following an injury there's always a scar. For the eye, one of the scar that we see is cataract, and it's so easy to see that scar. So trauma, injury to the eye can lead to cataract. Even though the injury might have occurred many years ago, but often than not, the telltale signs will always be there. That's why when people sustain injury, it's better that the injury is well managed and the patient report to the hospital on time, not for the present, but because for the future. Because 10, 20 years later, that injured eye may develop cataract. The other cause will include drugs. Patients that are on steroid, patients that are on some other tablets that, of course, can lead to cataract formation. And there are many of them. From patients on prednisolone, patients who are using cream because of skin rashes, patients who are on tablets like allopurinol, chlorpromazine. All those tablets can lead to cataract. For children, when mothers, pregnant women, when they are exposed to some infection, what we call infections like toxoplasmosis, rubella, syphilis, CMV retinitis, herpes simplex. Once the baby is delivered, the baby, apart from other problems, may develop cataract. So pregnant women need to be taken care of, and of course, they need to go to antenatal clinic to make sure that the baby and the mother is good, so that when they deliver their babies, the babies will not develop cataract from birth. Most times, patients with cataract, we notice a gradual reduction in their vision, as if there's an harmattan haze, as if there's a cloud. Majority of the patients, when they wake up in the morning, very early in the morning, the vision is good. But as the sun comes up, the vision sometimes will reduce, and they start wondering what was happening. Then towards evening, also the vision is good. But if a car is coming, of course, they go blind again. Such patients will develop what we call posterior subcapsular cataract, which causes a lot of glare and a lot of discomforting effects. And most of the time, patients are usually unhappy. Such patients may not be able to read very well, may not be able to look at things that is close, and they are happy when there is no sun. Other signs for cataract is some people may be able to read without their glasses, but that's for a short time. And the reason for that is that the part of the lens that is affected will allow them to be able to read. And such patients, even though they are very few, they are happy because they can throw away their reading glasses. The reason for the poor outcome may be other systemic problem, what we call systemic comorbidities like hypertension, diabetes, hypercholesterolemia, too much cholesterol. If all these other diseases are not well controlled and patient comes for cataract surgery, often than not, the result may not be good. Sometimes it may be that the patient already had issues with that particular eye, like glaucoma. If there's a glaucoma coexisting with cataract, of course, the result of cataract surgery will not be as perfect as it should be. Or sometimes some of the patients are on drops that are not prescribed by medical doctors, and some of these drops tampered with the structures within the eye. And so when the surgeon inadvertently opened the eye, of course the surgeon will be embarrassed, because, for example, the zonus or the support inside the eye has been eaten up by the eye drops that the patient has been using. And so there are several reasons why patient has poor outcome. But the most important thing is that a lot of people, even in Nigeria, are benefiting from modern cataract surgeries, and they are happy, they are driving, their quality of life has improved following this simple procedure. Following the procedure, most times the patient will need refraction, they will need glasses, and it's not the thick glasses that they used to use. It's usually the standard glasses that everybody is using. It won't be as thick as the one that they used to use. But apart from that, before patients come for surgery, we want them to stop some medications. Most importantly, a lot of people above the age of 40, 50 that are hypertensive are on aspirin. Aspirin tablet is good. It thins the blood. It prevents blood clots. Prevents them from having stroke. But if a patient is on aspirin and the patient comes for surgery, that patient will continue to bleed during the surgery, and the surgeon may not be able to see the operating field. So we always advise that patients should stop using aspirin that they use once a day. It may be vasoprene, it may be dispirin. They should use it. They should stop at least 2 weeks before the surgery. Then after the surgery, when the surgery is over, a day or two after the surgery, the patient can continue with his or her dispirin. The other drugs is the drugs used by men for prostate. Those who have prostatic enlargement are on some set of tablets. When patients use these tablets, the iris misbehave. And the iris is a structure, part of the uvea inside the eye. And once you open the eye and you see the iris misbehaving, we call it floppy iris syndrome. It's really embarrassing. And that itself can lead to bleeding. It can lead to poor surgical outcome. And it may lead to abandoning the surgery. Another important point is these patients who have diabetes. Often than not, patients who are diabetic may have poor control all along. When they want to come to the hospital, that's when they remember, and that's when they start using their drugs. But what is important is not the diabetic control in the last 2-3 weeks. What is important is the diabetic control in the last 3 months or more. Because a lot of people will start watching their diet, they start using their drugs religiously, but when you check their current sugar, it may look normal or marginal. But when you do their glycosylated hemoglobin, you probably discover that their diabetic control has been bad. Because when you do the surgery, the eye may refuse to heal, and they may develop what we call anterior segment syndrome. Those are some of the reasons why people have poor outcome for following cataract surgery. Another reason is hypertension. When patients are badly hypertensive and they are not well controlled, on the operating table, they can develop what we call explosive hemorrhage, which is a disaster, is an embarrassment to the surgeon, and the patient may lose the eye because of the fact that the pressure difference inside the eye will be accentuated, and after an incision on the eye, there will be a sudden separation, and there will be bleeding into the suprachoroidal space, and the whole of the anatomy of the eye will change, and of course the patient may lose that eye. And so most eye surgeons, ophthalmologists will insist that patient's blood pressure must be normal. If all these are in place and patient is well prepared, most times the result of cataract surgery is rewarding. Patient is happy, the surgeon is happy. Whereas in the case of glaucoma, it is garbage in, garbage out. If a patient comes to the hospital with advanced glaucoma, the result may not be good. But in cataract, most times the vision will improve if everything is okay. It's not impossible for patients who come in for cataract surgery to discover that their vision reduces after some time. That may be due to posterior capsule opacification, what we call secondary cataract. But that can be managed either by surgery or by simple laser surgery, which takes about 10 minutes on the table, on the street lamp. The laser light will cut through the opacity, which is on the posterior capsule, and the vision will improve drastically. We need to create more awareness, because in the community, as we are talking, we have these people who are not literate, though they may be very good in Arabic, but they didn't go to the Orthodox school, and they are busier than all of us call ophthalmologists or modern doctors, and we call them couchers. These are traditional surgeons that moves from houses to houses, from communities to communities, and they use sharp needles to push the lens into the vitreous. Patients will regain his or her vision, but the vision will not be perfect, and most times this patient will lose vision eventually, because the lens that has been pushed into the vitreous, which is at the back of the eye, will release lens protein that eventually will lead to the damage of the eye. Patient may develop secondary glaucoma. They develop a lot of problems like vitritis and whatever. And so we need to warn our relations, our friends, not to allow these barber surgeons to touch them. And it's not as if it's cheap. Apart from collecting money, they will collect animals from goat, from sheep, from cow, from them. And often than not, when the patient goes blind, they always blame it on the effect of witches and wizards. And so often than not, the patient will take the second eye to them. And of course, the same thing will happen again. And they are couchers, they are busy, they are well versed in Arabic, they can recite the whole of the Quran, and so a lot of people trust them, that they are godly people. But they are different from Orthodox doctors in the sense that they are the ones that will carry their trade into the patient's bedroom and sitting room. They won't bring the patient most times to hospitals. So we need to be aware of that. A lot of patients believe that it's due to old age anyway, and that they've seen everything, and so they won't want to come forward. Some tied it up to attack, spiritual attack, as if they are being punished by God, that maybe they've committed one sin or the other, and that's why God is punishing them. And some other people probably believe that it's due to, maybe playing higher game when they were younger, and it's the effect, it's the seeds of the higher game that is in front of their eyes. But the easiest way to know is when you look at your partner's eyes or your friend's eye, and in the center you can see a white tissue reflex, especially in elderly patients, then it's likely to be cataract. Look inside the eye, and then in the center of the eye you see a white reflex, then it's likely to be cataract. And please encourage such people to go to the hospital, and they can have cataract surgery done. Even government, federal government, and most state governments are supporting subsidized and even free cataract surgery programs in hospitals all over the country. I will encourage and advise people to benefit from all these programs by government, by individuals and non-governmental organizations who are out there to try to assist us in reducing the cataract blindness in our society.
All right, so I have a question for every one of us as viewers. What is the local name in your own area for the disease cataract? We would like to hear from you. Send your response to our Facebook page, our Twitter, and Instagram. As we said earlier on, sometimes though, the Yoruba may call it Toro Oju, Well, and several other places have several names for this very common disease. But let me quickly tell you, if you look at the eye of your neighbor and where the black part should be, if you see anything whitish in that central part, it's likely to be cataract. That person needs to be brought to an eye hospital immediately. All right, so now we're going to go on to the next segment of this program, which is the preview of the short clip on You Are My Eye. One exciting thing about most of these eye health films is that an appreciable number of the cast are actually ophthalmologists, medical doctors who are eye doctors, eye surgeons, but who are passionate about talking to us in a way that we all can understand some of the common diseases that we have and the challenges that we have in the treatment of each of them. And more importantly, the information that we want the populace to know about these diseases so that every one of us can make informed decisions on our eye care. Happy viewing.
Aderonke! Aderonke, I need you now more than before.
Look, I am very tired. I'm very tired. For you to go out, Aderonke, to go to the market, Aderonke, even for you to eat, Aderonke.
My dear wife, please, don't go. Please, don't go.
This begging is too late. As far as I'm concerned, I'm already gone.
Don't go. Aderonke.
Aderonke, come back now.
Sorry for keeping you waiting, ma. He was sent for from the hospital this morning unexpectedly. He will soon be back.
Well, that is one of the prices to pay for marrying a doctor, you know.
Abio, my sister. Oh, excuse me. Oh, he's back.
Thank God.
Abio.
Mrs. Rotimi, I am very sorry. I was sent for by one of my colleagues to come and observe a procedure in the theater. And you know, that is the nature of our job. Please, I'm very sorry.
No problem.
Thank you. Are we good to go now?
Yes.
How are you? Hey. Okay, shall we?
Nakuni, what is the matter? At first, it was this eye. Now, my second eye is gone. But before, I used to see. But now, I cannot see a thing. So gradual and painless, yet unrelenting.
We've been together through all the pains. We've been forever.
Ah,
We just had a flat tire.
Flat tire?
Yeah.
We have not seen a single car since we branched into this road. The road is so lonely, bumpy, and almost immotorable. I wonder how the people here get over to town.
And the last village is about 3 kilometers behind.
Yeah? Please help me. You see, we have no choice. We still have to wait. Let's just hope that help will come our way soon. Huh? Please wait.
Please. Oga?
Baba, good day, sir. Please, we need you to help us take our tire to the village for fixing.
I am going to the farm. You say I should help you. If I want to help you now, it means say I will go back 3 kilometers.
Emeka. No be snake. I think you should help these people. Please help them. I will send Ajani to pick up the tire from the organizer when we get to.
Now, wow.
But you will have to pay him some money.
No problem, I'll pay.
Okay.
I'll give him money. This is it, Baba.
Where's the tire?
He's there.
Okay.
I'll bring it.
I go carry up.
Thank you, Baba. Thank you.
Yeah. This stick you don't try. Look, you stay here. Where could they go? Now, where could they go? Okay. Make her go.
Go quickly.
Thank you, sir. Thank you, Baba. You are very grateful.
Don't mention.
Thank you. Thank you.
Don't mention. It is obvious you cannot continue on this journey. Can you come with me to our village?
Cataract is curable with simple, effective surgical treatment available within our country, and therefore this is a call on all of us to see that no one remains blind from cataract.
Well, that is it on the short drama clips on Your My Eye. In the next episode, we're going to continue watching that same film, You Are My Eye. You know, in the course of treating patients with cataract, we've had several questions, such like, oh, do you remove the eye and put it on the table and then clean it and then you put it back? I'm sure you now know that we don't do that. Some other people also believe, do you put animal eyes, sheep or goat eyes in our eyes after the surgery? The answer is no. So we don't want people to be afraid of this treatment of cataract, because the main treatment is actually surgery. But it's a surgery that we do under local anesthesia. Within a few minutes, it's over. And oftentimes is vision restoring. All right, that's it for now. And see you next time. I remain your regular host, Adepoju Feyi, on Sight Ed. We are all together in this business of preserving vision and restoring sight. Thank you.